At Care Fertility, we offer a full range of fertility services. It does vary slightly between the different clinics, but most clinics will start with either a fertility assessment or an initial consultation, and they find out during that they'll find out the kind of preferences of the person and what it is that they're wanting, whether they're just wanting the results of the investigations for peace of mind and forward planning, or whether they're interested in having treatment to achieve a pregnancy sort of there and then. So a range of different treatments, including ovulation, induction, IUI, IVF, ICSI. We have a sperm and an egg bank that we can use if needed. We also offer surrogacy in quite a few of our clinics, and also for patients that are wanting to preserve their fertility for whatever reasons, so medical or social reasons, or for patients that have got genetic conditions that want to have a baby but not have the risk of transferring their condition onto their children. We offer pre-implantation genetic testing as well. At Care Fertility, we like to think that we work in collaboration with the NHS services, both primary and secondary care. We're not trying to compete with them in any way. We do see patients that are NHS-funded within the clinics, but we will also see patients that are not eligible for NHS funding. And I suppose the most important message I would like for the GPs to know is that if someone is not eligible for NHS funding, whilst you could refer them into secondary care, that's often quite frustrating for the patients because they're waiting a long time for their appointment. When they get there, there's very little that the NHS can do if they're not eligible for NHS funding, if their BMI is raised, for example, or if they or their partner have got children already. So it's those patients that we'd like to see sooner, because just waiting for an NHS referral is not the best use of their time. We'd also want to see patients that maybe are eligible for NHS-funded fertility treatments, but they haven't got time to wait. So we know that's a unfortunate thing now, that patients are often waiting 9, 12, 15 months for an appointment. And if they're in their late 30s, early 40s, they haven't got that long to wait. So they might benefit from seeing us earlier, just for peace of mind, I suppose, to see if they have got time to wait or whether they want to privately fund their own treatment whilst they're waiting. If a patient is wanting to go down the NHS route of fertility treatment, then as the GP, you'd need to refer them to the local secondary care fertility clinic. They'll do all the investigations there, and if they consider that patient would benefit from fertility treatment and they're not able to provide that in the NHS, then they would give them a choice of fertility clinics to go to, and lots of our Care Fertility clinics do provide NHS-funded fertility patients for those patients that are eligible. If a patient is wanting to go down the NHS route, then obviously you need to refer them into the NHS like you would normally. But if someone is interested in paying privately for investigations or treatment, then you, as a GP, you don't need to refer them, you just need to signpost them to our website, and on the website they can either fill in a form online, or there's a phone number if they want to speak to an actual human, but either way our new patient team will guide them through the process and book any necessary investigations and appointments that they might need. We don't have a waiting list, so usually we can book the investigations and the consultation within a week or two.